Organization Global Report 2021 says Nigeria accounts for 4.6% of global TB burden, making it the highest TB burden country in Africa. This is why the wife of the Nigerian President, Dr. Aisha Buhari, is appealing to all stakeholders in TB control and detection to adopt a multi-sectoral approach to end the endemic in the country. Mrs. Aisha made the appeal at the opening of the 3-day National TB Conference with the theme Sustaining a Resilient TB Response in Nigeria, addressing the impact of COVID-19 and other diseases in Abuja. Represented by the wife of the Niger State Governor, Dr. Amina Bello, she said that effective partnership is key to TB total eradication, thus urging all to give priority to affected communities for response mechanism so as to cut down the continuous spread of the deadly disease. As part of the United Nations high-level meeting to successfully treat about 3.5 million children with tuberculosis by 2022 for universal access to quality prevention, diagnosis, treatment, and care, aimed at increasing the global investment for ending tuberculosis, reaching at least $13 billion a year by 2022. The Nigerian government and other development partners are working assiduously to achieve the set targets. Having that the country is 1 year behind, with unidentified cases of TB that call for urgent intervention to hit the desired results. Prior to this, these experts say the emergence of COVID-19 is an eye-opener, hence leveraging on the impact we serve as tools to ending TB in Nigeria.
Partners, civil society, academia, media, religious and traditional institutions to work together to end TB by supporting a multi-sectoral approach and effective coordination in our efforts to end tuberculosis in Nigeria. Most importantly, I call on everyone to put affected communities and those living with TB at the forefront of our response. Our joint success depends on involving them as full and equal partners in the fight against this disease, as seen in the anti-stigma fashion show today. Lastly, I kindly urge all stakeholders to support Stop TB Partnership Nigeria, because it is only through effective partnership that we can all work together to end TB in Nigeria.
Nigeria remains one of the world's top 10 high tuberculosis or TB burden countries, with one of the lowest TB case detection rates globally, despite our collective efforts in TB control since 2003. This conference presents another opportunity to build upon our partnerships to change the narrative on TB in Nigeria. The U.S. government, through the U.S. Agency for International Development, or USAID, has continued to advance the government of Nigeria's goal of becoming a TB-free country. The U.S. government's cumulative bilateral funding to support efforts for TB control in Nigeria has surpassed $230 million. This support has increased the provision of quality diagnosis and care for TB patients and their families. In addition, the U.S. government also has invested significant resources under our President's Emergency Plan for AIDS Relief, or PEPFAR program, and its cooperating agencies to prevent, detect, and treat TB in people living with HIV. Today, as you convene to deliberate on the impact of the COVID-19 pandemic on TB control and to promote best practices in TB programming in Nigeria, I would like to reiterate our shared commitment to promoting innovative interventions that will support this country's efforts to increase access to quality care and treatment for tuberculosis for all Nigerians.
Speaking at the event, the Minister of Health, Dr. Emmanuel Ehanire, and the acting chair, Stop TB Partnership Nigeria, Dr. Ayodele Awe, noted that despite progress recorded towards TB notification, much work is still needed, as most TB cases are yet undetected, stressing that working with all partners is paramount to accelerate impact across the region.
Months into this year, 2021, Nigeria has already surpassed the total number of TB cases notified throughout all of 2020 by 7%. For the first time, Nigeria could be notifying up to 200,000 TB cases by the end of this year. I thank you all for your hard work in the fight to end TB in Nigeria. We know that we still have a way to go to reach the targets for ending the TB epidemic, and that most of our TB cases are yet undetected. We are not as close as we would like to be to the United Nations high-level meeting target on TB case finding of TB prevention, preventive treatment, or any other thematic areas set aside to be achieved by 2022, or the milestones for ending TB in Nigeria. But we must work with our partners to accelerate and scale up our current efforts significantly, mobilize needed domestic and international resources for implementing our National TB Strategic Plan 2021 to 2025 to put an end to this epidemic in our country.
The TB cases we are looking for are actually in private facilities, and Nigeria has been one of the countries that have we say we are not finding all our cases. We are supposed to see 400,000 TB cases each year, but we are only seeing about 300,000. So we are missing about 75% of our TB cases. And the reason was that because, one, we think that there is a low awareness, but now we have just, this COVID period teach us to say, actually, the TB cases are being treated in most of the private facilities by pharmacists, but are not coming under treatment. Our experience in 2020 to what we have done this year, and he said we are going to reach for the first time 200% increase in TB. You understand? So the COVID was bad, but it's opened our eyes in TB.
Meanwhile, the WHO country representative, Dr. Walter Malumbo, represented by Chimbaru Alexander, and the executive director KNCV-TB Foundation in Nigeria, Dr. Gidado Mustafa, commending Nigeria for their giant stride to about 15% increase in TB notification in 2020. First, lamenting the challenging impact of undetected cases as it continues to spread across communities. Hence, recommended stringent measures across the board for the deadly TB control in the country.
Nigeria was rather among the few countries that recorded an increase in TB notification by 15% in 2020. And I would like to congratulate Nigeria for this achievement. However, about 70% of the estimated TB cases in the country in 2020 were not detected due to some challenges noted following the declaration of the COVID-19 pandemic. I know that the Ministry of Health and partners are already trying to address these challenges. The undetected TB cases continues to fuel the spread of the disease in the community, which gives a challenge to all the partners on the platform today.
The TB situation in Nigeria looks challenging at the moment. But if you look at the last 2 years, it has equally demonstrated that Nigeria is in the right direction. All it needs is the three following tactics, which include infusing urgency into the response, accelerating, and also taking things to scale. As long as we sustain this, our right direction will commensurate with this acceleration to end TB in Nigeria. I am very hopeful that we can end TB in Nigeria and globally. I request that if we have to end TB in Nigeria, I put forward the following three requests. One, to the government. You have done it before. You can do it again. Please do it for TB. Do it because TB still remains your second cause of death among all infectious diseases. Do it again because TB have demonstrated the highest return on investment for $1. We can do it. Turn your attention a little to the TB control program and invest in it. Second, my request goes to the TB stakeholders. Get out of the comfort zone. Engage other stakeholders. Ensure multi-sectoral approach is mainstreamed into our TB planning in general. My last request is to the media. You are the catalyzing factor. You are the facilitating factor for all this to happen. Come to the aid of TB.
The 2021 three-day National TB Conference is aimed at leveraging on the self-determination to curb other related disease outbreaks such as polio, Ebola, HIV and AIDS, and COVID-19. even as these experts are optimistic that shared knowledge will promote best practice for TB case finding, detection, and elimination within the shortest period. Vincent Okushi, Quality Television.